We're here today to introduce you to the TheraSIP swallowing and oral motor fitness product. TheraSIP Fitness is a progressive resistance exercise tool for strengthening the oral facial musculature. What exactly is progressive resistance exercise? Well, it basically is a set of exercises that help strengthen muscles by exercising them against the resistance that progressively increases as the muscles get stronger. It's the same kind of training that they use with weights or resistance bands and weight machines. TheraSIP Fitness, however, uses a set of 3 micro-sized straws which require pressured sucking of thin liquids in order to stress the muscles. Using the principles of resistance training, TheraSIP focuses on ensuring that the patient reaches overload. Overload is basically making sure that you find some way to make the task more difficult. There are 4 ways to make the task more difficult. The first way to achieve overload is by adjusting frequency or increasing the number of exercise sessions. The second element of reaching overload is that of intensity. This means that you have to make the exercise increasingly difficult as the muscles get stronger. The third element of reaching overload is that of time, increasing the length of time that the exercise is performed or the number of exercise sessions. And last of all is type. You can increase overload by choosing more than one activity, such as TheraSIP or chewy tube, or possibly the tongue press. TheraSIP is relatively easy to use. First, you fill the unit with water or flavored beverage. You instruct the patient on how to perform an effortful pressure suck. You test each of the straws and get a baseline measure in milliliters of how much fluid they're able to suck. And lastly, you select the easiest straw and begin a vigorous routine with that straw. The importance of an effortful pressured suck is that it strengthens the lips, the cheeks, and the tongue. It also activates the palate and possibly the long pharyngeal muscles. The goal of TheraSIP Fitness is to bring progressive resistance exercise to the treatment of swallowing, also to the treatment of oral myofunctional disorders, and to provide a pharyngocise tool to help with swallowing and to prevent trismus in post-radiation head and neck patients. TheraSIP treats drooling, faulty tongue positioning, tongue thrust, weak cheeks or difficulty chewing solid foods and keeping it in the mouth. And it provides an added method for treating swallowing and feeding problems. TheraSIP Fitness can also be used as part of pharyngocise with patients that are pre or post radiation. It can help with swallowing, but it can also help with working the palate and working the posterior pharyngeal muscles in order to prevent the onset of trismus. TheraSIP Fitness comes with a graduated cylinder to measure and to reinforce greater pressure sucking, a lip block to help keep the patient from putting the straw too far in, a gliding gauge to track the size of each effortful suck, 3 micro-resistant straws of varying difficulty, and 1 clear outer straw that they fit into. And lastly, a cleaning brush. It's important to remember that the success of progressive resistance therapy tools is dependent upon how vigorous the therapist utilizes them, that the patient is worked to the point of overload, that the therapist is consistent in the number of trials and the consistency of practice sessions, and that the therapist advances appropriately the straws from the easiest to the most difficult. TheraSIP Swallowing and Oral Motor Fitness is another product from TheraSIP that's clinician developed and research inspired.